p.m. I would like to call the October 6th, 2013 meeting of the Ayer Board of Health to order. The first thing on our agenda is more of a placeholder than anything else, just public input in case anyone came to us between the time that the meeting minutes were done and the actual meeting. And we do not have anything of an official nature. Nobody asked to come speak to us. I don't know, Heather, if you think we should discuss anything about
I don't know anything about it over the course of the last week, except on my way home this afternoon, my phone rang and it was Bridget. And she was saying that there was some discussion. She called me because she knows I'm on the road between 4 and 5 on Monday nights. But she was we very briefly discussed it because I don't know the nature of how it got routed in here. I don't know any of that.
Okay.
But with respect to the inquiry about access, she's going to put a phone call in to the state sanitarian who runs the Division of Community Health to get affirmation as to what our jurisdiction is with respect to a private home. And her reason was just so she can have the right answer for the right people. Either way. But she, we didn't really get into any real discussion about I'm familiar with the property and the history of it.
Yeah.
And so she had just indicated that there was some communication back and forth. And I don't need to see any of that. But she was, and I said to her, why don't you call Paul Hoffman? He's the director of community health. He's the state sanitarian, if you will, State Department of Public Health. So she is going to speak with him just to affirm really what our path is as a local board, because there is a boundary between private,
there is.
So without getting too much, I know, what I said to her is I was a little bit apprehensive to get into a full discussion about the property without the property owner or any of the stakeholders involved.
Yeah.
But she just wanted me to communicate that to you.
Okay.
And that's all.
Okay.
The end. I've done my duty.
Passed along
As a matter of fact, I was on the phone with her when I was in the Rotary, and you were behind me. Because Mary's behind me right now. We're all heading into town hall.
We almost have a quorum.
Her husband got called away to New York, so she was going to come.
Yeah.
So anyway.
Yeah.
All right.
Okay.
That's all.
So that's fine. Thank you for that.
Yeah.
That's good to know.
I thought it would be helpful.
It is very. So the next thing, fortunately, we have kind of light agenda in terms of things that we need to get done. We have no one special appearing before us, so I'd like to look again at the solid waste hauler draft regulations. Did
you get feedback from Bridget yet? Because that was kind of our next step, was waiting for her, right?
I had showed Bridget this morning at Town Hall the areas that I added that she had requested, which were the non-criminal disposition process, just making, some kind of proposed setbacks for
I saw that
property lines and so forth.
Yeah, that was for like restaurants and stuff. Yep.
Yeah, and then her other request had to do with the written educational materials for recycling. So I called those to her attention, but left them with her so that she can get back to me if she has anything specifically.
Okay.
So I thought Mary's point from last week about how you've done regs in the past of kind of just going through them section by section might not be a bad idea.
Right.
Yes.
Okay. Madam Chair, before the Neshoba Board of Health quarterly meeting last week, I went early so that I'd have a chance to talk to Jim Gariffi.
Yes.
And I have a lot of respect for Jim. He's been with the Board of Health a long time. And I told him what we were working on, and he kind of rolled his eyes. And I said, well, right now, and the last one we had was 9 pages. He said, oh, no, don't do that. He said, if you have them, because this is something the Board of Health has to enforce, and we're a small agency. He said, what I would advise you to do, if you can keep it down to 3 pages, do it. because if it's too long, it's open to interpretation. But one of the things you really want to do is, in the opening part here, list every one of the state regs there. And that way, and the language that says that you'll always follow. So he said if the DEP changes something,
Yes.
we will not have to go back and have another hearing and amend them. He said you don't want to do that. Some towns have them, some don't. Littleton is going to be rewriting this, and they've had theirs for, I think, only 2 or 3 years.
Yeah, this is.
But he
short.
said if you keep them short, if you adhere to whatever they say with regards to the state, and he said in 2 or 3 years, generally when you put new regulations, then you see how they're working,
Yeah.
and you think, okay, this is what we've got to do.
Yeah.
So that was his suggestion.
Okay. And that is a good one, to reference everything here that we think might have any bearing on
Well, I
this.
think if there's anything that you pulled from the state, like if you pulled, I don't know, just for grins, I get where you're coming from, and I get where he's coming from.
Yeah.
Let's just say section 4.1. Say you put all those bullet points you pulled right from the state, right? You could say, you know, as per blah blah, you know, I don't know, you know, you could.
I see,
You
yeah.
could reference the general
what it-
sense of what we're looking for, but then you could. I'm not saying this one is from the state. but
Right.
I get what
Yeah.
he's saying. So what you did with section 4.3,
Yeah.
you took out that list that took up a quarter
Yes,
page.
right.
So, and you put it and you reference, so I understand that now.
Yeah.
You know, I don't know that you can really put a number on pages, but if there's a way to reduce the length of it, I agree. Because what you want is
Yeah.
you want people to read it.
Yeah.
You want people to understand it.
Exactly.
And at the same time, you don't want to be back here in 6 months if the
Nope.
state has changed something
Exactly.
that we tie
Yeah.
directly to. So maybe there's an opportunity to kind of see if there's a consolidation of some of these that might,
Because we don't want 4 people to look at them and have 4 different opinions. We want somebody to look at it and understand them right off the bat.
Exactly.
No confusion.
Exactly. I totally agree with that.
so like the under, you know, some of the permit application requirement, you know, this section 6, you could probably concatenate it into something that might say, you know, the Board of Health shall develop an application that covers, and so I work with legal agreements, and right now at my job, I'm redoing legal agreements that are 15 years old.
Wow.
But one of the legal agreements points to a criteria document.
Okay.
And the legal agreement references the criteria document. And so what happens is that criteria document can change. It's one piece
Yes,
of paper
right.
that says what the software has to
Right,
meet.
right.
But the legal agreement never has to change because it's going to reference the most current thing. So
Yes.
maybe, I don't know, because I didn't look at these in depth, but
Yep.
you know, you could maybe take this permit application and renewal and reduce it and say you shall, and then you just create the form that says what's going to be on it.
Yeah,
Does that make sense?
It does, and actually that did occur to me that what we could do.
'Cause that's a page right there,
instead
Mary.
of- Yep. Instead of putting all of this stuff in the
Board of Health
regulation.
shall supply an application where required
Yes,
information
and then
can
we
be.
could have that application as part of the package that goes out.
Exactly, but the
yeah,
to the
application
hauler.
stands separate
Yeah.
and isn't tied into
Yeah.
the reg. Because let's
Yeah.
just say for grins, vehicle insurance suggestion changed to something over $1 million or
Yeah.
something like that, then we'd have to go back. So I would agree that if we could just concatenate this section into the Board of Health shall supply an application requiring information, blah, blah, blah.
Yeah.
And then you take all of this and Jane works her magic on the computer and makes an application that has these things.
Yeah, I do, and I actually have a couple of application
There you go.
formats
Yep.
from some other towns that we could look at.
Yep.
Another thing, though, to remember too with this version is, this version being 8 pages, it's got a couple of things going on here. One is that Arial is not the most space-saving of fonts. So,
right. There's a font and a point issue.
yeah.
I know.
I
saw that too.
I always, when I'm doing something as a draft, I 1.5 line space it.
Right.
So a lot of this is going to come down just when it goes into the, like the Times New Roman and into the single spacing that we use for regulations.
Right. So I think we're moving in the right direction.
Well,
I think we understand.
It's dark for we elderly, so we can read it.
That's
I
right.
like that.
That's right.
Yeah,
So
it
we
is.
pull
It
that.
is. I think it's a very readable font, but
Right.
I
If we had to split the difference, I would say 3 is ideal. If we had to go, I would say we could try to keep it no more than 5.
I agree with that.
But only if what I want to make sure of is if we, at the end of the day, if we end up again creating a good reg that meets 5 pages, that's the goal.
Yeah.
I think 5 is good. 8 is a lot, but because 8 just gets into reading like a state reg.
this is not going to be 8 pages.
No, I don't think so.
It's just not.
And I think that, but I read through it today when I was eating my lunch at work.
Yeah.
And, it's funny because a lot of it is, I know it's things that we currently just don't have any controls over. And I know in my heart that it'll be very good to have some controls over some of this. It's just the emptying of the dumpsters, the 7 a.m. rule,
Yeah,
and the 7
yeah.
p.m. rule. I mean, some of those things about the property line setbacks and the amount of time a dumpster can sit on a property without special approval. I mean, all of those
Yeah.
things are going to do really right by the residents in the town. And so, but I think, if we went through another revision and had it set up a little bit.
Yeah, I'm sure, I would be really surprised if this doesn't, the other thing too here is there's not a whole lot of it, but we do have line out things
Yeah.
that are,
Right.
taking up
So,
some.
I mean, for purposes of, I read through the definitions, if you want to start on page 1, I
Yep.
mean, I didn't see, I didn't really see.
The only definitions that I put in here too is, which is why it says also refer to, I put in the definitions of things that appear in this document but do not appear in the CMR. So,
understand.
and it's.
I think it's fine, you have 1, 2, 3, 4, 5, 6, 7 definitions, I mean, the definition of a dumpster between a temporary dumpster, I think that's relevant, because I think people
Yeah.
need to know what a curbside pickup container is,
Right.
The one question I did have is under solid waste container,
Yeah,
could you combine, so could you have curbside pickup container, right? And then you have that, and then at the end you could say also known as solid waste container. Could you combine those two, or are they two truly different, 3.3, 3.4?
the solid waste container is a more, it's a more general, it's
okay.
it's both
Okay.
curbside pickups and dumps.
Oh,
So
I'm
it's
sorry,
kind
you know
of
what, you're
the-
right, I'm sorry.
It's
Okay,
like any container
that's fine.
into which.
Yeah, yeah.
But what we could do is look through, now that some other things have been moved out of the regulation, might not be as
that you?
necessary. Yeah, probably. I can ignore it. It's probably my husband not remembering that I have Board of Health tonight.
Okay, okay.
So from there, the general requirements, it's really just saying that, you have to have the permit. These are the only things that you can,
Right, you could probably combine those, well, you could say obtain a permit, collect only, you know what, yeah, all right.
waste.
What I was actually wondering was 4.4, does that reference a specific CMR that we could reference as opposed to the 4 bullet points to kind of go back to? Will that change? Just as a talking
It
point, you can go
might.
look
It
it up
might.
offline if you want. I don't need to take up too much of
Yeah,
the
no, I
board's
might have
time.
it. I might have
But is this, if it's referenced someplace,
Yeah, that would be a good one to move if we can. So let me just make a note of that. Yes.
Which one again?
oh, that was just the one where
4.4.
4.4.
Yeah.
If, again, if we can reference a CMR as opposed
Yeah.
to a list.
Yeah.
Yep.
it might be a very specific list that might not change, but if it's pulled from someplace,
Right.
something that's dynamic that may
Yeah,
change.
exactly. No, I would agree with that. I think that is good. The 4.5, it kind of ties into the educational
Yep,
materials.
listing.
So what can
Yep,
you
yep,
put?
yep,
How do we
yep,
want to
yep,
have it?
I like the way 4.6 came out, where we did agree that they can carry a copy of the permit
Yeah.
at all times. And then we also reserve the right to require that that kind of keeps that in whole, like if we find that we need to require them to
Yeah.
put a sticker on,
If
that's
we
fine.
choose
Like
to
we
do that
reserve
later.
that right.
Yeah.
Um,
It's the times. Not transferable, that appeared in pretty much everybody's.
I know like
Regulation.
4.11 has very specific reporting requirements. I wasn't sure if we could make those bullet points into a reference, or if we want to have those 4 things that say you must give 1, 2, 3, 4.
Yeah, this one I spoke to Mark Wetzel
Yeah.
today,
Yeah.
and told him that, after tonight's meeting, when we discuss, I'll get him another copy of this. And I could ask him if we could possibly even say, I do have a draft of a reporting form, so this might be something
report-
we
right,
could turn
another
into a form
You could
as
staple
well.
it to the back of the application
Yeah.
and make it just part of the
Yeah.
application. So those little criteria there, that way, again, it reads what you want it to read.
Yeah,
I may just blowing through this tonight.
yeah, there's the non-criminal, we took out PW, so it's Board of Health and Police Officer.
Yep. I see some strikeouts. That's good. Strikeouts, strikeouts, strikeouts. Dumpsters, yeah, this has the property line setback, which is what Bridget had thought about and asked us
Yeah.
to include. That's fine. And then the permit application, we'll just move that onto its own standing document.
Yes.
Okay.
So that would be, I just want to make sure I get this
I
correct.
have a question
in
for
my
you
notes.
and we're done.
This is section 6.
Yep.
The one thing that we probably
I mean,
want
we
to
can
leave in
include
here-
something in the 6.1, absolutely.
I think the one thing that we probably would want to keep in here is the liability and workers' comp.
Okay, so you could put that up underneath, you could say at the time of the initial application, blah, 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 the permit shall include, and it should include proof of liability and workers'
Yeah.
compensation, or something like that,
Okay.
that just keeps it up in that initial section, and then,
Yeah. And then, so we probably could even make it that, it could be, the information on the permit, including this, and then the
Proof of liability.
certification that they're going to comply
That
with
can be
all parts
all
of the reg.
on the
That's all going to be
application.
on the application.
Right.
right,
But
you
I-
could put if you had to put a summary line up there to make
Yeah.
sure we call attention
Yeah.
to it, we can look at that.
Yeah, okay.
Because we're losing an entire page in this regard, so that's
Yeah.
good. Permitting shall renew, yep, November 1st, blah, 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 Board of Health shall review and act. Yep. Applicant permitting, enforcement and inspection. Yep, you have to have enforcement and inspection in here.
Yeah.
Improper disposal, revocation. So here's one thought is that, let me see, improper disposal shall include disposal of the second. Do you think, does it make sense to move this definition of improper disposal to the front page where the
Where
other
are you now?
definitions are, 7.4? Or no? I'm open to discussion on that point.
Yeah,
Just because you find yourself defining it there.
yeah. No,
Can you just
actually, I
move
think
it to
that's
the
a
front?
good
Should be
point.
under
Yeah.
the definitions
Yeah, move,
there, yeah.
Citing, failure to pay, board's discretion, violations, board may enforce. I'm just leading through
Yeah.
here.
Oh, the permit fee. this was something that we had talked about last week. We talked about,
Not
you know,
having the
making
fee
it.
in the reg.
Yeah, I took
Right.
it out completely.
Yep.
Because I noticed that when I was looking at a lot of other towns' regs, it actually was
You
not.
just put it on the application. That's what we
Right.
used to do in Acton.
Yeah.
They were right on the application.
Yeah, exactly. So we're just saying we're gonna determine it,
Yep.
we're gonna post it.
Yep.
We'll let you know.
Absolutely. Right.
So
You'll get it when you get your
renewal.
renewal.
Yeah.
Yep. Otherwise, I was okay with the rest of it. I know, yeah, variances, you always have to give an opportunity for a variance.
Yeah.
Severability, indemnity, that's right, because by us permitting them does not, we don't have any liability
Yeah.
to them.
Doesn't constitute a contract.
No.
Right, it just gives
Yeah.
them the permission to work.
Okay, great.
My follow-up, if you want to clean it up again, that
Yeah.
would be great.
Yep, I will. The other thing I can do with it is print it out
Make
more
it
in a.
look like it might look when we get closer
Yes,
to
I was
adopting
gonna say,
it.
let me print it
Like
out
the
in
text
the
of, like
version.
the,
That'd be good.
Yeah,
whatever our
yeah, I'll look at what it looks to
Our
me like
branding
it's
is-
a Times, font. I'll try to do a size that they look like they're, for the most part, single space.
single spaced is what it looks
Yeah,
like.
Yeah.
That's a state, you don't want to look like that, because
No.
nobody will be able to read it.
But I think some of our regs actually.
This looks like it's Times New Roman. It might be, this might be 12 point, I don't know.
Yeah, I
This
think
might
that
be
might be
11.
Yeah. Okay.
You know what, if it can still be read,
Yeah,
Yep.
and we don't have to have,
all the spacing too. Like what she
Yeah.
was saying, is
Yeah.
that she's
Yeah.
got it 1.5
Yeah.
spaced right now.
This is in reviewing format.
Right.
That's
Yeah,
right.
it's not finished product format.
Jane,
at
in
all.
your writing experience, did you do any like proofreading? Do you know, like, did you do any of your technical writing? That maybe once we have it all set, that you could maybe just read through it just for,
I'd certainly be happy.
do you know what I
That
mean?
would be great,
It's funny,
yeah.
I have a proofreader that works for us at work, and she sends stuff back, and I'm like, I thought I wrote it well.
Yeah,
It's got
exactly.
red pen all
No, that would be
over
good.
it, but,
That
But
would
you
be
know,
really good.
people who aren't in the business don't understand the process. And
Right.
you really have to look at things with fresh eyes, because you
Yeah.
can't see something. Even myself, I'm much better looking at something somebody else
I
has
worked
written.
for an attorney
It's true.
once, and he taught me to
Yeah.
proofread by reading backwards, because in your
Yeah.
mind, you put words in. You know, so it would be easy for you to put the word "of" just mentally. If you're reading something, it might not really be there, though.
That's a.
You just read
That is
fluidly.
an excellent
Yeah,
idea.
yeah,
And also reading back and forth orally is
Right.
really
yeah.
Oh, I
Anyway,
know.
just
Yeah.
once you
But
have it
yeah, I'll
cleaned
be
up,
happy.
maybe
Okay,
just
sure.
have
Yeah.
a good proofreading done of it,
I'll
because
be
there's been
happy
like
to
3
do
different
that.
rounds of revision.
Yeah.
that's all right. You want to get it right, we don't want to
Exactly.
have to be amending it
Not
next
again.
year or
It's
having
true, we
some-
don't.
That's
Yeah,
why I
this is
said
true.
to you, it'll go into effect whenever we get it done
Yeah.
That's
and
right.
have the hearing.
Exactly.
That's it.
That's it. All right.
Okay. Got it.
Good round.
Okay.
Okay, I will take care of that. So we'll just put it on.
That's fine.
Again
Look
next
at
week,
another-
Jane, and we'll.
And
do
I don't know that you need to
another-
do any red line
another
changes
review.
at this point. You can kind of.
Yeah, I
prep
think
it
we're
for
at a
us
point
to
where we
read.
can-
Yeah, I think so
Yeah.
too.
Make it start to look real.
Yep.
Okay,
Okay, so Madam Chair,
yes,
I will make a motion that we approve the minutes of September 8th, 2014 and September 22nd, 2014.
Second.
all in favor?
Aye.
Okay.
We will do that. Do you have, Jane, did you bring down like clean copies for us to sign or?
Oh,
of
yes.
Those minutes, yeah.
Actually, I do.
Good, then we're getting pretty caught up with minutes.
Good.
Yeah.
Yay. Yeah, I have my, let's see, not lie. Ask me no questions, I'll tell you no lies. Let's see. Here. There you go. let me, wait a minute. That doesn't look right. It's too close to the fire. Let's see.
Oh, yeah, that one.
That's,
Yeah, that's kind of
This
cut
one
off
looks
weird.
kind of,
Yeah.
the one on the 8th.
This one looks right.
This one's fine.
is
Yeah.
that the 8th? The one on
The one,
8th?
the one that's funny is the 8th. The 22nd is fine.
Okay, here, sign this one. I think that's, let me make sure that that's the right.
Well, I
See if
can't,
it's the right.
let's see, I can't do it this way. You know
Let
what,
me
you know
look at
what, I'll
this.
tell you what.
Let me look at this. Let me just.
If it isn't, we've already approved it, we can just
We just
sign
sign
it.
them at the next meeting.
We'll sign it.
They don't even need to, we'll just sign them. Or put them in the
We've
mailbox and I'll
approved
come by
them.
and sign it.
Yeah,
Okay, can do
Yeah.
that.
Yeah,
Just put
is
a
this
clean-
For some, you don't have, you didn't bring your.
I did, I scribbled on mine.
All right. I'm sorry, for some reason this
Don't be
was-
sorry.
didn't,
If you print a
out.
clean copy, if we sign it before the next meeting, that's fine. If not,
okay.
you just sign it. It doesn't have to be on the agenda. We'll just sign it when we get here.
Okay,
yeah,
all right. I'll make
Okay,
a note of
great.
that.
all right.
All right. M. Spinner, not M. Skinner.
Yes,
Will
please, please, I don't want to hear that
enlighten
anymore.
us.
All right.
How was the meeting?
Well, I enjoy going to the meetings because I hear the problems of the other towns, and so many of them have to do with things that we don't have,
Yeah.
septic and stuff.
Yeah.
One of the things they did this year was they rearranged some of the positions when Carol Horgan retired, and they have hired on at least a 6-month basis a social worker to try and deal with the problems of hoarding, which, as you know, is a big issue.
A big deal.
And what a lot of people don't realize that it really is, it's kind of what do you want to say, an emotional thing, but some of it is not. When you say hoarding, we're not talking about somebody that is necessarily a person that is dirty or anything like
Right.
that.
No.
Right.
In one instance, they had a complaint, and the man lived in an apartment complex where the people underneath were afraid that the balcony was going to collapse.
Yeah.
The social worker worked with him, and he actually goes to something like, I suppose, Alcoholics Anonymous, only this is people dealing with that. He
Yeah.
recognizes that he has the problem, and he goes to the board's meeting to tell them that he's still doing fine. So that's worked out well.
Yeah.
The second one was a couple that they had had a tremendous amount of complaints about the property, and it turned out that yes, it was cluttered, but they were older. They had health problems, and you know how you say, I'll get to that, I'll
Yeah.
get to that,
Yeah.
and you don't, and pretty soon it becomes a real problem. So they've had somebody that's gone in that's worked with them. So
Yeah.
they're thinking right now, it looks as though it may be something they want to continue, and it's,
think it would
and
be
it's a
great.
matter of getting a social worker knows the agencies. People don't know who to call.
Right, right.
So that has worked out very well.
I
Now,
agree.
is that social worker, is it someone that has some specialized training in the hoarding issue, or?
I think more, and I don't want to know for certain, but I think more in the lines of putting people together with the agencies that can help them
Okay.
type thing.
Yeah, yeah.
But it had,
Yeah.
Jim said it had become a real problem in the past year, more and more complaints about it.
Yeah.
The second thing we talked about is budgetary things, which everybody is talking about now. About 30 years ago, when Neshoba Associated Boards of Health was smaller than they are now, they joined the state in with regards to pensions and,
yeah.
you know,
Yeah, yeah, yeah.
retirement
Second.
benefits, et cetera. And I know you'll find this so hard to believe that the state didn't do their due diligence and have not been putting away the money that we're assessing as they should. So now you have people retiring, and there's a problem with, yes, getting this money up.
Is that Middlesex County retirement, I think? That's what I paid into when I was in the
Really?
government.
Well, it's the state retirement.
Yeah.
So you can only go back and reassess someone 3 years. So now they've just got hit with that reassessment.
Wow.
So I said, oh my Lord, what are you going to do? And he said, well, that they were looking at everything now.
Yeah.
I said, will it make a difference in your assessment to us as communities? And that they'll be voting on the budget at the December meeting, so I'll know then. But it might be the financial person thinks they need to look at everything they do.
Yeah.
You know, like, are they charging enough for their various
Right.
permits,
Right,
that
Right,
kind of
right,
thing.
right.
But imagine when you get hit with, you know, oh, you owe $500,000 for last year when you,
Retirement.
you know, so
Right.
it's
Yeah,
a big
imagine.
issue right now. Yeah. So that was that was pretty much, they go over at each quarterly meeting, each discipline, the financial person gives a whole up, you know, this is how this discipline is run. She
Yeah.
goes through line by line,
Yeah,
all the
yeah.
different things. The nursing person gives it, you know, how many home visits we had, how many hospice,
see.
the whole thing.
Yeah,
So, yeah.
Okay.
And, you know, I like hearing what other communities, what
Yeah.
their problem
Yeah,
is. And
exactly.
You know what I would be curious about, and you probably could find it out pretty easy, is the numbers over the last year for Lyme disease in the area. I know that they only know it when it's reported in, and
Yeah.
I know sometimes it doesn't get reported in by the physician.
Yeah,
Yeah.
right.
I would just
Yeah, true.
be curious, even in the December meeting, if they happen to have numbers, because I would be curious about
Does
that.
the
It
state
seems to
track
be.
that?
It's reportable, believe it or not, it's actually reportable to the local board of health. By statute, it's reportable, but we typically don't see a lot of it reported. I don't know if it's just become, I mean, it used to be that it was hard to test for, so they would
Yeah,
just
but now
prescribe
it's different.
antibiotics
Yeah.
instead.
Yeah.
But
And they've had one other town, Stowe, that has made inquiries as to joining. And Jim and them went down
Oh.
to do a presentation, so,
wow,
yeah,
interesting.
yeah.
What exactly are the towns that show the covers?
Oh,
Like
my
15
God.
towns, it's
Yes,
like 13 or
15.
something.
15.
So if you think about this area, right, it's most of our contiguous towns.
Yep.
It's our
Okay,
contiguous
yep.
towns. It's Boxborough.
Yep.
So I can think of it if you gave me time.
Yeah.
It's basically, it's Littleton, Ayer, Shirley, Boxborough, Lunenburg, Lancaster, Ashby, Dunstable, Groton, Harvard. So it's
Pepperell.
So it doesn't divide
Pepperell has
along-
its own, I think.
It doesn't divide
No.
along.
Oh, no, are they the
Pepperell.
Neshoba? Oh, you're right.
They
You're
joined-
right.
they were the
Townsend has
last
their
one
own.
to join.
Yes, that's right, that's right.
Okay. But
Townsend,
so
I
it
think,
doesn't
has their
cut
own.
at the county line?
Absolutely
It's like Harvard,
not. It's a
Shirley, or
region.
Worcester
Nope.
County.
It's a
No,
region.
Okay.
Pepperell was the last one, what,
You know-
probably about 4 or 5 years
Okay.
ago. Yeah.
I know, back to your discussion about hoarding, some of the things were just sad. You know, I went into an inspection and
Yeah.
it was for dolls.
Yep.
But the person had
Yeah.
downsized from a home
Yep.
to an not assisted living, but like a 55 and older.
Mhm.
But these dolls, they meant something to her
Right.
outside of putting them in a storage unit. But
Yeah.
when they had to go in to see her, they called us, and effectively it was classified as hoarding because it was
Yeah.
creating a hazard. It was creating
Yeah.
an entry issue if there was emergency
Yeah.
things, you know, and you're right, it's very emotional. And 99% of the problem is having the right agencies involved. So I
Correct.
think
Yeah.
it's fantastic.
Yeah, I like
We
that.
used to sometimes have to act as the social advocate sometimes to get people the help.
Yeah.
When I was in Acton, we worked with Elliott Community Services, Elliott Mental Community Services out of Emerson. I think they work under the Emerson
Okay.
umbrella. but sometimes we would get called out by a caseworker to cite the tenant because they knew they were having issues, but in order to get them services, we had to,
right,
so
right,
it really is complicated because hoarding is not necessarily defined as a disease, if you will. It's probably like a little taboo. People see it on TV.
Yeah.
That might be
Yeah.
helping people understand that it's not somebody that might be ill.
I
It's
think
not always
actually-
trash.
I think in the new DSM, it actually has a little
Yeah.
designation.
Yeah.
I don't know if it falls
Yep.
under the general category of like
Right,
excessive
but some of it,
disorders,
you're right,
or-
you downsize, you have a lot of people that have
Yeah.
lost their homes, they're downsized, they don't know what to do with their stuff, they'll get to it later. The
Yeah.
cost of a storage unit, outweighs what their income is, so
Yeah.
they're like, I'll get to it.
Yeah.
And it's not trash,
No.
sometimes it
no,
is
it-
trash.
Well,
but it's not.
to the
It's
people who
dolls.
are, it's not.
These are
No.
porcelain dolls, these are beautiful dolls, I'm
Oh,
like,
jeez.
anyway, so I digress,
Okay.
sorry.
Okay, well, thank you very much. Do we have anything from Bridget? Did she give us
Yes.
any materials?
Yes, And I haven't had a chance to look at it.
Okay, so these have to be okay, these look like the regular renewals.
Yeah, and
Okay. Yeah. Let's see here, package store. Cold station.
Okay. All right, so
See
she's
those?
reviewed
Some
the
renewals.
proposal for Taco Bell Lunch Charter Foods. And and they're really gutting the place
Yeah.
over there. They've been working
Yes.
diligently.
After nothing happened for a while,
I
it's
couldn't
moving
believe it.
fast. Okay, here's that one.
Oh, and this is to do with
yeah, and I have another copy.
land use Shepley's Hill
Yeah, that's for
Control.
Pam. 'Cause-
Yeah.
Oh, thanks.
And that's been put up on the website now. so-
Okay, all right.
Um,
Tolman Ave in Ayer? Where is Tolman Ave in Ayer?
we don't, huh?
Tolman Ave in Ayer? We don't have a Tolman Ave,
No,
do we?
no. No,
Let me take a look at that.
we do
Okay.
not have a, we do not have a, no.
Maybe just silence it.
No, we do not have a
Let me just take
Tolman
a quick
Avenue in Air.
Calvin Street?
We have Calvin, no, look on the other side. No, on this column.
Right. Tolman?
We do not have a Tolman Ave.
Yeah, I don't know. So my guess is it was
So I'm gonna take this
Yeah.
until the RAB meeting, and then I'll give it back to you after.
Okay, I have
Skunk.
another copy upstairs, actually. for
Oh.
you. I left it on the
Skunk
desk.
sent it in. Oh, I bet you the dog was probably, yeah, I understand. The dog killed the skunk,
Yes.
had exposure, but I don't know where that is. But clearly, because she lived in Air, they sent it over to us, but clearly they have the wrong town, so.
Yeah,
Oh.
Yeah, 'cause
Is this the one
I don't know, but we,
we got a call on last week?
that was the last meeting, you told us about that one, I think.
Was it?
This is just some skunks. The dog killed the skunk.
Yeah.
Yeah,
But we
that's-
don't, we do
that
not
was
have.
No, that was the dog killed the skunk in the yard.
Oh,
Right, but we don't-
I think she is trying to say Calvin Street.
No, but right up here.
I know, it says, yeah, it does say Tom. I'm wondering if somebody just misunderstood.
Yeah.
Well,
Well, it's negative skunk, so it's
Yeah.
completely.
Good.
what I,
Negative skunk, what a wonderful skunk to have.
what I wanted to ask you, since we're reviewing Bridget's material, have we heard anything since we sent the letter out to Walk and Roll?
Jane has an
Yes.
update on that.
Yes. The Mr. Kim, or whatever, I can't remember his name, but
What's all right?
But the proprietor of Walk and Roll came in and wanted to know what he needed to do. And
Oh, please.
I said, that, and I showed him that there had been repeated violations. And I told him, he didn't speak, he
Yeah.
had trouble, there was a language barrier. But I tried to tell him that he needed to be very serious about addressing the
Right.
things that had come up in the inspections, and I sent him off to see Bridget. And I pointed out where the Neshoba was,
Okay.
Associated Boards of Health down the
Okay,
street.
good.
I showed him out the window where he needed to go, so
Okay.
I sent him over there.
When we got that from Bridget, that has to be in August? Early?
When did we send that
we-
letter? We sent the letter in September.
We sent-
We
Yeah.
agreed in August, though. I think it was her
Yes.
inspection from August.
That was
But-
my first meeting, I think, so I didn't come on board until, maybe
That was-
August.
I think that was
Yes.
August, yeah.
But I think
Yeah.
that we talked about at that meeting, and I remember talking about, you agreed, Heather, that every time Bridget goes there, there's at least 4
There's at
complaints.
least, I want to
And
see.
3 of the 4 are the same
I just want to see
thing.
that next inspection.
And we
Yeah.
wanted her to go in and do another inspection, to not wait
Yeah.
90 days or anything. So
Yeah.
can we follow
Give him a
up?
chance to maybe follow up with her if he did.
Yeah.
She
You know,
didn't mention anything
sometimes
today.
it just
No, she
sometimes
didn't.
it just takes an owner to just simply be present and lead his staff into what they know needs to be done.
Yeah.
I don't believe that they don't know what needs to be
Right.
done.
Right.
I believe that they understand it. I believe that they have good intentions, but sometimes these things maybe the business gets in the way of the safe food handling operations, but that's not my concern, nor do I care.
Right.
It's I think
But this is an establishment,
this
though,
is a
that
food
we've
establishment,
had
period.
we've had
Sure.
complaints from residents too, so
Well, and even honestly, even if there wasn't complaints, and every time we saw inspections from there,
Yeah.
if there's a chronic issue with them, and that's why we agreed to send them
Yeah.
that letter, and
Yeah.
clearly it's resonated
August
a little
25th.
bit.
Yeah.
So let's just see where it goes.
Yeah.
Maybe.
But
for,
I do
you know.
think, in that there may be a language issue, and we may need to make sure that he understands exactly what we're asking him to do. But,
Yep.
Yeah, and and it may be a training issue there, but really what he needs to do is work within
Is there
the
any
food
other-
code,
but
the
I
sanitary code.
felt that he was really open. I mean,
Okay.
to doing whatever needed to be done.
This
I
this
felt
is ongoing, though. This
that,
is,
Yeah.
that he was, so,
Well, if you could just
Well,
make
we'll
a
see.
note to follow
We'll
up
see.
with
I'll
Bridget
follow
in a
up.
week or
Get
so,
follow-
yeah,
yeah,
and
We'll
see.
see where he
Yeah.
goes with it.
Yeah.
okay.
Mail? We have any mail?
yes, we do.
Okay.
Let me
Oh,
get
can
it.
you pass
I'm
these
not-
back to, those are headed back to Jane.
Mail. Here's the mail. Let's see. Not sure. Let's see, it's in here.
And
I
you
might
know,
have some more mail in
Along that string of the discussion about the walk and roll, it is, for any establishment, we are not necessarily picking on them, but if I were to see any establishment show up with the amount of chronic issues out there, I would want to take the same path.
I agree, yeah.
Oh, this is the one that I gave her and told her you might like to see that. It was in,
Oh,
it
yeah.
was all that was
Yeah.
in there, they're having. And I think
Oh,
they
that
have
is interesting.
upped their fee too. It's kind
Oh,
of a
thank you.
Thursday.
If you'd like to see that. So this is, oh, these are the emergency prep. Okay, I got it. Okay. And this, you can take a look at this. This is what started off.
Oh,
Okay.
okay.
There.
Okay.
It's really amazing. The Shirley Health Panel. You got a lot of
Yeah.
nice byline.
I know it. That's interesting. Okay, so that's
Happy reading?
all right. This I'm going to keep.
Okay. Public hearing.
Flu clinics, yes.
Hang on. I'm all set.
Okay.
Thank you.
Oh, this is about that other one, so
Earthquake
that's just
drills, really?
So,
Are these coming back, is this coming back to me, or
Yeah.
do I need to send this?
no.
And this was the other. If you want to look at this one, that was the other thing there. Okay, and that's it for mail?
No bills?
No bills?
No bills this week.
Okay.
No bills. That's wonderful.
How novel is that?
I know.
Okay.
And I don't think, do we have any miscellaneous? I don't think we really have any miscellaneous.
Thank you.
So administrative.
Okay, well, I've got a bunch of stuff.
Okay, so we already did, we can cross off, we did mail review and bills there. So, yes, you had a few things you wanted to
Yeah.
update us.
The enterovirus, D68, they are seeing more cases. The Massachusetts Department of Health announced a confirmed case of enterovirus D68 on September 23rd. The patient is a school-aged child with a history of asthma who became ill in early September and has since been treated and released from the area hospital. This is very rare still. It does affect children who are usually have asthma, but there have been some disturbing developments, and that some of the cases in the Midwest have been mimicking polio.
Mm-hmm.
I heard that.
And so I thought it was a good time to bring this up. And that is, we've been living in a state of grace for several decades now. But my father had polio, and when I was 5. And I want to say that it's really, really important. In this day and age, we're really used to having antibiotics and all these treatments for things. And sometimes we neglect the obvious, which is rest. You know, making sure your children get adequate rest, making sure that, you know, they're washing their hands, making sure they're eating properly, and just commonsensical things. because it can make the difference. And
getting their vaccinations.
and getting their
When they're
vaccinations.
supposed to.
But the other thing is keeping your child home from school if they're not feeling well. And for adults too, if you're not feeling well, stay home from work. And this gets into another whole thing. I think that from a public health standpoint, it's really important as we see these things develop that are not treatable with the antibiotics and things, to be a little more proactive about not going out when you're not feeling well. And it's an important issue.
I know,
I
not
think-
enough people do.
Well, no, people
You know.
come in here all the
I
time,
know.
they're sick. You just unfortunately can't do anything about
Is
people's
there
common
any,
sense.
is there any opportunity to grab something off of the state site and just put it up on our website so we can at least direct people there to read? I know there's public health
Yeah.
fact sheets that you can
Sure.
just put
Yeah,
out
I
there.
think
Yeah.
that would be a great
Yeah.
idea.
Yeah,
So,
they
you
come
know.
through and maybe update them every week.
yeah,
Yeah,
Yeah.
because we've also got the Eat Bullseye, and I've been watching that, and now we have a confirmed case in the United States.
We have several.
And that this is another issue where if you're not feeling well, it's really important not to spread your germs.
I know.
And
Yeah.
we all do it, and we've been living in a state of grace, but it's really important, and maybe it's time to really seriously look at some of the ways we treat illness. And, you know, if you're feeling under the weather, get more rest and take care of yourself. And we haven't been doing that
Well,
very
Well, and
well.
there's, it's difficult for people too that don't have sick time.
That
That's
don't
right.
have sick
There are
time,
a
and
lot
it's a
of-
terrible
yeah.
thing.
well,
And,
but again, that's not for us to do.
Nope.
right,
Of
course
it's
it's
not,
not. No.
but,
Right.
but I'm bringing it up here, and because it impacts everybody's health. And, so,
Yeah, I think that
Okay.
if you can pull some links, as Heather suggested, to, and the West Nile is really,
Yeah.
kind of the same thing.
Yeah,
The
we have had it.
enterovirus, West Nile, Ebola, anything that we can
yeah,
pull from, credible, particularly the state health department websites, and do either links or,
they've been trying to really downplay, things, but it's time for people to really, do whatever they can to make sure that they're getting enough rest and eating properly and.
yeah. And it's good to be aware of what's out there too. And it wouldn't hurt while we're about it to, the other thing that's been an issue here for a long time is Lyme.
Right.
And to just, review what kind of links could we put on our website to some Lyme resources
Yep.
Right,
for people, so.
which is really important. Okay, Shepley's Hill Land Use Control Implementation
Yeah, what
Plan.
happened?
And
We had a scanning?
we had a scanning issue, and evidently the stuff came in and it was printed two-sided, but it was supposed to be printed two-sided, but it came
Yeah.
through printed only on one side.
Oh, okay.
they-
That's what it was.
They resent the stuff, and it has been loaded.
So it's
on
reloaded on our
It's been
site.
reloaded
Okay,
on
good.
our website, so it's been all taken care of.
Excellent.
And Mary's been busy
Yeah.
purging our bulk
I saw that in
tanks.
person
That's
today.
awesome. That's
Yeah,
fine.
that's great.
How are we doing
Thank
on
you.
that?
Thank you.
Yeah, we're doing,
We'll have more
Keep
space
going.
up
Yes,
there.
we
That's
will.
wonderful.
Yeah. And I've been busy taking tests or doing things. I finally did the ethics thing. I finished
Yep.
that. And I started the emergency preparedness training.
I have to do mine too.
And it's
And we did
extensive.
verify, correct, that
Mary
that
does
Mary's
not.
fine. You take it once, and even if the
Right.
training revs up,
Correct.
you don't have to take it again.
right.
So.
I
I
knew
mean, the
that.
general practices don't change. I would have been shocked if they said she had to take it again.
Yeah.
But it is like drinking from the fire hydrant, though. When you take the one, then when you take the other one, you're like, didn't I just take this?
Yeah.
Because it's really a lot of reinforcement of the
Okay.
incident command system.
Yeah.
But it's really
Okay.
important because if we ever had to activate the high school in our emergency dispensing plan, you'd really need to kind of understand it in a total thing. Mary knows it from when she worked in health, in the health
Yeah.
field, you know,
Yeah.
it would come second nature to her.
Oh, you two are absolutely the number one and number
Right,
two on my
right,
call
right,
list. If
right.
that ever happens.
And that's one of the things, the first things it says is that the hierarchy in this
Yeah.
thing is not the same as it is in normal life. It's
Yeah.
who has the most
It's right. It's who
expertise.
knows this
Yeah.
stuff, and
But
I
there's
am
a
neither
lot-
a nurse nor a
And we have
full
tons of
time
equipment.
health person.
Lots
We do.
to know. Lots to
Yeah.
know.
Yeah.
Yeah.
This actually, I just wanted to see if anybody else knows about. We have a camera in the office. Is that something that's associated with the supplies that Ken Geekus gave us, or is
I
that
think we
something
got that
else?
under the grant. We
I would
got
guess
most
you
of
did.
our things
Okay,
under the grant.
okay.
Because we got ours in Acton under the grant.
Yep.
We had we
Okay,
had a tough
yep,
book
okay.
laptop, we get a camera, we get all kinds of
We
different
did.
equipment
Okay.
to
And
have.
what are we supposed to use that for? And binoculars.
So at some point, and I don't want to get off track on this
Yeah.
because I don't want to lose track of our expeditiously going through this agenda.
I
But
know.
we have an emergency dispensing plan that the Board of Health was charged with creating post 9/11, post anthrax. You know that time period where the town and the Board of Health had to develop an emergency dispensing plan on the chance that we ever had to do a mass inoculation or otherwise some kind of a treatment of everybody in town. And so we've met with the emails like the Ken Geekus. He's our coordinator, our local rep. I kind of started working with him to update the plan because with the high school being renovated, the whole layout's going to be redone. So I'll include you in those discussions. Like he and I will continue to keep.
That
Right
would be
now, we have like an
fabulous.
interim plan at the Page
Yeah.
Hilltop School
Yeah.
where we could funnel people through. It wouldn't be pretty or comfortable, but it would get done. When you see the enormity of this plan, it's pretty serious. Like, so when you were just discussing enterovirus and treating and illness and stuff, this emergency dispensing plan was put into place as a direct result of any kind of emergency need. There's two sites in town. It was the high school, and then over on Snake Hill was like the drive-through one where you would just grab if they had to just dole out medications to you in a drive-through capacity. But anyway, so that training that you're taking kind of complements that plan because that way we all would have familiarity.
Yeah.
99% of the time we would probably yield in this case to, it might even be the police or fire chief in an incident like that, but we would have a lot to do with it as far as
Yeah.
the actual
Exactly.
structure
Fire
of it.
chiefs, the emergency
We would go to, we
management.
would
Yeah.
yield to the fire chief, but we may own a domain inside,
Inside.
you know,
I see.
be part of a,
Yeah.
So he'd be the
one of the
primary
teams of the
coordinator for the
group.
town.
He would probably he would be the incident commander.
He is the incident.
Yeah.
But it's a
Okay.
whole protocol.
There's
as
an
to
entire
the-
protocol, so we would
Yes.
probably be on a team or a task force, but we're part of the strategic plan of the actual dispensing site. So, and that's where we have all of this equipment that Mary was just talking about. We have the two-way radios and the laptops and the camera.
Yeah, I knew the radios and stuff. I wasn't sure what the story was with the laptop or the.
It really is
the
just for
camera, I'm
portability.
sorry,
Cameras
camera.
probably just
Take it with
documentation.
Yeah.
Yeah.
Okay, got it.
Yeah.
Yep.
And we've got
Okay.
stuff stored at the fire
In the
station.
trailer.
down there.
Okay.
Yeah.
Yeah.
Oh, okay.
Mm.
Well,
it
that
might be-
solves the mystery.
Yeah,
Yes.
it might be good while we're working through all this, Pam and myself, is doing an inventory of what we got and where everything is and what it's useful
Yeah,
for.
no,
Should be up
idea.
there, the
Yeah.
list
There
should be
might be
there.
a list.
There
I
is
might be a
yes.
list.
Yeah,
There
might,
is.
that's
Yeah.
true. Might
I
be.
think Ruth did a
Okay.
pretty good job at.
Yeah.
I
Okay.
didn't
And
see
And we
it.
haven't gotten anything new since there, or did we?
He
do a thing with
replaced out the
replacing
two-way radios,
or-
but that
Yes,
was it.
okay.
Yeah.
Oh, okay.
Okay.
Okay. So, I'm just talking because I don't, and also when I emailed him for more information, he said after I take the training, he'd like to sit down and talk to me for 45 minutes or
Yeah.
so.
That would probably
Just
be
to
good.
show you, there's
Yeah.
an online platform now that the Han is using to communicate to
Okay.
local boards of health
Yeah.
if there was an incident.
Yep.
Just different things, probably just to get you an access, because I think it was just username, password has been
Yeah.
assigned in the past individually.
Okay.
So,
Ah.
and then he has to check it off that he's given you that training.
And I wasn't in today, but Cindy, and I wonder if she gave them to me and I just don't have them. Cindy moved me over to the Z Drive and everybody,
We all got it.
that's
Yeah,
what this
that's
is.
what
Yeah, that's what, yeah.
We're all
that's
set.
what
So
this
now
was.
you're all set.
We're all
Okay,
set.
Okay.
Great.
Okay.
So I wanted to make,
Excellent.
that is awesome.
And can I just mention something before I
Sure.
forget? Because the username and password made me think of this, and I've been meaning to ask for it for months now. Can you get for me our, like, account login and password for the Mass Associated Health Boards?
Sure.
We have one. I
Yeah.
don't know what it is, though.
I had to get one.
Okay, if you could
I
just-
had to get one. If you write or whatever, I think everybody has a separate one.
Oh, okay. So I just tell her that I'm on the board in Ayer, and
And
we,
they'll
so we
give
pay
you-
our dues to it. Okay,
Right.
all right, got it.
And they'll
All
give
right.
it to you, because they gave me, and now I'm automatically in there, and I just haven't remember
Okay.
mine. But, yeah, just email them,
Okay,
and they'll
got
get
it.
right back to you.
All right, I got it.
And, I think that that's all I have to say, unless anybody has any questions for
No,
me.
thank you.
No.
Yeah.
No, I think we're okay. So I think for next week's action items, then it's, there's one for me for
Just the
the
clean.
trash
Yep.
hauler regs cleanup. And I believe that is it.
Well, hang on, don't.
Oh, all right.
Okay, you want suggestions?
Yes.
You might want to give Carly another call because she still hasn't picked up the bar book.
Yeah,
So,
I
and,
have called her, and I've called her twice, and
well, it was still there today.
know,
you
I
know,
saw.
so,
Yeah. Yeah, see, to then try again to see if you can
Yeah.
get a hold of her for the.
Wow.
because it's into October and we'll be getting a lot of stuff done. I would like
Right.
you to put down our budget.
Okay.
And everybody knows that I'm an extremely fiscally conservative woman. However, I think that, and I'm not trying to compare us to the bigger departments with public safety, but it seems to me that some of the smaller departments are taking a hit, and these bigger departments seem to always have money to do something, to give raises in the middle of the year, to change positions, etc. And what did we put this year for ours? We put $300 extra.
For legal ads.
I know.
And pretty much that wouldn't even cover it, because when we're going to have this public hearing, it's
Yep.
probably going to be at least another $80 or $180, $190, and then you've got to publish things afterwards. So I think we really have to take a good look at ours. We have nothing really extra. All I ever say to you is, one time I asked for some more money so that we would have a little extra hours. So if we wanted the administrative assistant to work 19 hours that week, we have it. We really have nothing to spare. And
I know.
was
I
told,
agree
we
with
can't-
you.
We
Yeah.
can't get anything so that I said, I'm not looking for anybody to get benefits, but by the same
Right.
token, we have a ton of stuff on our
Well,
plate right
we
now, and I think it's
I
time we're more
absolutely
realistic.
agree. I agree with you, Mary,
Yeah.
and I actually would say to this board, you know, public health is working when people don't hear anything about health-related issues.
Yeah.
And by the time there is a problem, it's too late. So to have any kind of extra funding, I think this board, since I've been on it now, 3 years, just
Yeah.
about 3
Yeah.
years,
Yeah.
has been very fiscally responsible. And I
Yeah.
attribute that to Mary. I mean, Mary, you know, is very budget conscious of what we
Yep.
spend. And we've always been very aware of what our real expenditures are as far as what we would
Yeah.
like them to be.
Yeah.
Now, I could sit here and say that I would love to initiate, what if we wanted to run an awareness program? We don't have the extra
That's
few
right.
$100s to go to a
We do
printer
not.
to get something made for us.
Right. That's right.
And it's not a complaint against any other department whatsoever, but I think that if we truly want to do more than just be a reactive board. You know, if we don't want to be the board that just responds to complaints, does housing inspections, does food inspections, does enforcement, passes regulations, if we really want to make a difference, then we may want to think about some of the things that we want to do as well, because like I said, public health, people don't necessarily think about public health until there's a problem.
Right.
And sometimes it's our job to do a little bit more than just be here to address a problem. We could do something more preventative. We could partner with other agencies in town on some joint efforts, whether maybe through the schools, or we were talking about prescription drug issues, I think, at the last meeting.
Yep.
Huge.
You know, what if we
Yep.
wanted to partner with a local substance abuse group just to bring a speaker in? We don't even have $100 to pay for coffee for that.
Right. No,
That's
right,
what
we
I'm
don't.
saying, is I'm not looking to open our wallet and let everything, you know,
Yeah.
get all the cash in.
But by the same token, until this year when all the computers came under the IT, everything we had up there, all
We
the
paid for it.
computers came out of the grant.
Right.
And then anything related to stuff that we were printing with regards to emergency preparedness and everything, we took that all out of grant funds.
Right.
So
Right.
a big storage file cabinet that people don't know, those are like $900 to
Yeah.
buy out of a grant.
Yeah.
Right. I know. That's what I
We
mean,
have
is we've run
tons
lean.
of stuff.
Yeah.
We run
Very
very
lean.
lean, and I think that it's time to
It's
take a
commendable,
realistic-
and at the same time, it's open to, you know, being taken advantage of to a degree. Like always looking at our budget and never really
know.
wanting to do anything
There's
more than.
nothing there
Right.
though.
Right. Well, I
So
think-
maybe we need to think about what we might want to do for
I was
next
just
year
gonna say
too.
that. I think
like
we
maybe we
have
want to
to-
do something around. We were just talking about Lyme disease. Maybe we want to sponsor somebody, maybe up in the Great Hall, to talk about Lyme disease. Maybe
Yep.
we want to sponsor, you know,
Drugs
somebody
are
to
the
come in to talk about
huge
prescription
issue
drug,
right
you
now.
know,
drugs
abuse.
are significant. Jane and I were talking today about doing something with domestic violence.
That's, I mean,
Yeah.
all of
And
it,
having
you know,
some-
the umbrella that we
Yep.
cover as far as just educational programs. I mean,
That's the one area that I feel that we really are falling short on, is that
well, because our
we
board
don't
does
have-
tend to be that we
Yeah.
respond and we react and we inspect
Yeah.
and we,
Yeah.
you know, we promote a couple of flu clinics through our nursing, you know, through our nursing
Yeah.
service, and well child clinics, and all those are great.
Yep.
But if we want to own some of the public health activities in town,
Yeah. I think that actually would be a good, dare I call it, homework assignment, is
Just
think
to
about
think of
what, right,
something-
think about things that, what would we like to do? Where do we feel that we can
you know
make
what?
an impact?
Let me ask you, Mary, and you might know, or I know Carol's retired now. Did you know if the region, like Neshoba or the Neshoba Board of Health region, if they ever have done any kind of like community health assessment? Do you know, like where they pull like a sample
Yeah.
of communities
Yeah,
and
I
they
know
try
exactly
to,
what
they
you
come
mean.
up with questions that kind of identify, we know prescription drug use is
Yeah.
a big
Prescription
deal.
drug is
Yeah.
huge,
Yeah.
huge.
And you know, we know domestic violence, it kind of, it bubbles over in the media once in a while and it goes away.
Yep.
But
it never
we
really
know it
goes away.
happens.
What are we doing, you know, what are we,
Yeah.
to assess what we're doing here in this
Right.
community
Yeah.
Right.
and what that,
Right.
those out.
But maybe there's a partnership opportunity there with the police department to kind of bring somebody in or do some kind of campaign. So there's a lot of opportunities for partnering, but if we don't have anything to bring to the table,
Exactly.
Right, right.
you know,
Exactly.
we can't really do a lot. Our schools and some of the groups up there, AEF and stuff, they do great programs, and I admire them for that. I would like to partner with them on some of it to gain, even to get into the youth audience in town too.
Yeah.
The senior center is a great place, the Council on Aging building, to have
Yep.
somebody come in over there and talk, you know, about something relevant.
Well, I had a program, I put together a program over in our building on Pleasant Street on prescription drug use and abuse. And it's huge. There are more people dying of prescription drug interactions
very
and
big, yeah.
and ODing on prescription drugs in some areas than in traffic accidents. It's a leading
Right,
cause of
right.
death.
Yeah,
It's shocking.
it's definitely an issue.
And it eclipses, we hear a lot about illegal drug use and abuse.
Right.
But
not the ones
It's the prescription drug use
It's the prescription
that-
drugs that
Yeah.
are the greatest problem right now. So,
So,
and a lot of
alright.
it is education.
So we can think of
we
some
can
things.
think of it
Yeah.
and
Yeah.
put
It was a
it
great,
back.
it was a great for you, great thing to bring up though, Mary. I think you're absolutely right.
And then we
I
need to,
agree.
just as a reminder, get out the tobacco permits need to go out.
Yeah, now what happens with that? I'm not entirely sure is that initiated by
No, we send the renewals every
us?
year.
We send
Oh,
the
yes,
renewals.
we send the
Okay.
renewals.
Okay, so
Yeah.
you're.
So I have to draft a letter.
No, it's
No,
all
you
up
just
there. It's all up
standard
there.
letter.
Oh,
Yeah.
it's a
It's all
standard
there.
letter.
It's
but-
all
Yeah.
up there.
Standard
Yeah.
packet.
Are those good for 2 years?
1 year.
No, 1 year.
1 year. They-
Okay.
You're thinking of the thing from the state that's
right.
2 years.
Every 2 years,
Yeah.
you have to put a copy of your DOR certificate or something in there.
That is what I'm.
It's every
Yeah.
year.
Okay.
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 But the whole packet should be up there. It's just,
Yeah,
Yeah.
yeah, I think so.
but we need to get it out because they have to have everything back by December
That's
31st.
correct.
Or
Yeah,
they
okay.
can't sell anything.
That's correct.
And then
Okay.
after we get it done, in case there's anything new, we always, I think, send the list to Joan to make sure
Yeah.
she has it, that's all.
Yeah.
So
Okay.
that can go out.
Okay.
Okay, all right,
So
that's
that's
good.
it. So I don't have anything else, so.
Just last but not least, I don't know when it's going to appear, but Jane and I had a nice discussion today with John Bishop from Neshoba Publishing, who is the person who's been
He's the new
assigned to
reporter,
Ayer.
yeah.
New fellow. And he spoke to us about rabies, and so, we just talked to him about the importance of informing people of bites and keeping up with those immunizations and so forth, so,
Especially for cat owners.
yeah,
Yeah.
yeah, getting the word out about cats and ferrets, don't forget ferrets. So, I don't know, that will, I think, appear at some point,
Very good.
all right?
So, nobody has anything else?
Nope.
It's 6:45. I'd like to make a motion to adjourn.
Second.
All in favor?
Aye.
Aye.
Aye.